The upper limb muscles and the nerve supply. It is divided into 6 parts. Pectoral region, the muscles connecting the upper limb to the vertebral column. Scapular region, arm, forearm, and the hand. Muscles of the pectoral region are the pectoralis minor, pectoralis major, and subclavius. 3 muscles in the pectoral region. Pectoralis minor and pectoralis major is supplied by the lateral and medial pectoral nerve. Name is pectoralis and supplied by the pectoral nerve. And the subclavius muscles, which is supplied by the nerve to subclavius. So in pectoral region, pectoralis minor, pectoralis major, subclavius. The muscles connecting the upper limb to the vertebral column are the trapezius, which is supplied by the spinal part of the accessory nerve, latissimus dorsi, which is supplied by the thoracodorsal nerve, and the nerve root are C6, C7, C8. Levator scapulae, supplied by branch from dorsal scapular nerve. Nerve root is C5. Rhomboid major and rhomboid minor, supplied by the dorsal scapular nerve C5. So 5 muscles connecting the upper limb to the vertebral column: trapezius, latissimus dorsi, levator scapulae, rhomboid minor, and rhomboid major. Scapular region: supraspinatus, infraspinatus, teres minor, subscapularis, and the teres major. And there is also deltoid. Supraspinatus and infraspinatus is supplied by the suprascapular nerve. Nerve root is C5, C6. Teres minor and deltoid is supplied by the axillary nerve. Nerve root is C5, C6. Subscapular is supplied by the upper and lower subscapular nerve. Nerve root is C5, C6. And the teres major nerve, lower subscapular nerve. Nerve root is C5, C6. Muscles of the arm. Arm has 2 compartments, the anterior compartment and the posterior compartment. And the anterior compartment has 3 muscles at the rate BBC: brachialis, biceps brachii, and coracobrachialis. The brachialis has 2 halves, medial half and the lateral half. This lateral half is supplied by the radial nerve, and all other nerves are supplied by the musculocutaneous nerve. In the posterior compartment, the muscles is triceps brachii, which is supplied by the radial nerve C7 and C8. In the forearm, it has front flexor compartment and the back extensor compartment. In the front, there is 5 superficial muscles and 3 deep muscles. And the superficial muscles are pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris. Pronator teres, flexor carpi radialis, palmaris longus, and flexor digitorum superficialis are supplied by the median nerve. And flexor carpi ulnaris is supplied by the ulnar nerve. In 5 muscles, all 4 muscles are supplied by the median nerve except flexor carpi ulnaris. In the name itself, it has flexor carpi ulnaris supplied by the ulnar nerve. And these 3 muscles are the component of the cubital fossa: flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. In the deep compartment, it has 3 muscles: flexor digitorum profundus, flexor pollicis longus, and the pronator quadratus. Flexor digitorum all are supplied by the median nerve, anterior interosseous branch of the median nerve, except the flexor digitorum profundus medial half. So in the forearm, in the flexor compartment, all muscles are supplied by the median nerve except 2: flexor carpi ulnaris, which is supplied by the ulnar nerve, and flexor digitorum profundus, medial half of the flexor digitorum profundus, which is supplied by the ulnar nerve. All other muscles are supplied by the median nerve. In the back extensor compartment, there is 7 superficial muscles and 5 deep muscles. Anconeus, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. These all muscles are supplied by the radial nerve. Anconeus, brachioradialis, and extensor carpi radialis longus is supplied by the radial nerve, and extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris are supplied by the deep branch of the radial nerve. There are 5 deep muscles: supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. These all are supplied by the deep branch of the radial nerve: abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. These are the component of the anatomical snuff box. Muscles of the hand. It has in the thenar group. In the thenar group, it has 3 muscles. This is the adductor of the thumb. Three muscles: abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. And the adductor of the thumb is the adductor pollicis. These 3 muscles, thenar group, abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis, is supplied by the median nerve, and this adductor pollicis is supplied by the ulnar nerve. Hypothenar group. In hypothenar group, it has 4 muscles: abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, and palmaris brevis. These are all supplied by the ulnar nerve, as this is in the ulnar side, supplied by the ulnar nerve, in which palmaris brevis is supplied by the superficial branch of the ulnar nerve, but all these 3 muscles are supplied by the deep branch of the ulnar nerve. There are 4 lumbricals: first, second, third, and fourth. First and second is supplied by the median nerve, and third and fourth. First and second lumbricals are supplied by the median nerve, and third and fourth lumbricals is supplied by the deep branch of the ulnar nerve. There is 4 palmar interossei, and there is 4 dorsal interossei. These are all supplied by the deep branch of the ulnar nerve. Palmar interossei do the adduction of the fingers at the rate PAD, we can remember as PAD. P for palmar interossei, do the adduction of the fingers, and DAB, dorsal interossei, do the abduction of the fingers. This is all about the upper limbs, muscles, and the nerves.